And for hours and hours and hours, senators supporting Senator Cruz taking to the floor and taking a stand.
I intend to speak in support of defunding Obamacare until I am no longer able to stand. I'm happy to yield for a question without yielding the floor.
How long will it be before Congress acts?
Congress in Washington get an exemption.
Socialized medicine is and has been everywhere in the world it's been implemented a disaster. I'd grab 100 people at random, and I guarantee you they would say, we got to fix Obamacare. This thing is hurting people. I want to take the opportunity to read 2 bedtime stories to my girls. I do not like green eggs and ham. I do not believe we should shut down the federal government. The only reason we might shut down the federal government is if President Obama and Majority Leader Reid decide they want to force a government shutdown.
But not everyone agrees with Senator Cruz's strategy. Senator John Barrasso, also a doctor, joins us. Nice to see you, Senator.
Thanks for having me.
Okay, so why don't you like the strategy that, or why aren't you joining, I should say, Senator Cruz's strategy?
Well, I was on the floor this morning talking about the problems with the health care law, and I'm going to be on the floor again tomorrow morning talking about the problems with the health care law. There are a number of different tactics involved. Defunding is important, but it doesn't go far enough. You actually need to eliminate the entire law because there are still 20 taxes that continue to be collected under the Obama health care law. We actually have to repeal the entire law. And some have said, well, if we don't get it done now in the next couple of days, that it's over. We've surrendered. I'm never going to stop until this health care law is repealed, and that could be next year. It could be in another administration. It's going to be when we take back the Senate, and we have to win back the Senate to actually repeal the law.
Okay, so I mean, I understand that this, for lack of a better word, filibuster really isn't a filibuster, but what Senator Cruz is doing and a few others like Senator Marco Rubio and Senator Mike Lee, that it's not going to stop the vote. I mean, that's ultimately what they would like, but that's just not happening because of the way the rules work. But I'm curious, why aren't other Republicans, I mean, do you have anything, are you opposed to this strategy? Because it certainly is putting the spotlight on the issue, whether you're for it or against it. More people are likely to be talking about health care bill tonight than if this weren't happening. Yeah.
That's why I encourage the continuation of this discussion.
So every Republican, well, why don't you go help them?
I was there earlier today. I'm going to be there tomorrow. Every Republican voted against this health care law in the House and in the Senate. This health care law is a disaster for America, not just in terms of their health care, but also for people's jobs and their paychecks. Today, Barack Obama had to call in Bill Clinton to try to bail him out on the health care law. They were in New York together because the law is so unpopular. It's taking one hit after another. The more we talk about it, the more the American people are disgusted because the more they learn about it. Now, one of the things you said is no one read the law. You know, I actually did read the entire bill before it was voted on, which is why I was such an adamant opponent of the health care law.
I tried to read it, and I have two degrees in law, and I've read statutes my whole life before I came to TV. And I thought it was incomprehensible.
Because so many times it says the Secretary of Health and Human Services will come up with rules and regulations.
I mean, it's so embarrassing. I mean, if anyone actually saw it. Now they took the bill, and then they shipped it over to HHS, where they have something like 27,000 pages of rules and regulations, which is sort of another problem, because all these people over at HHS wrote these rules, and we never elected them. We don't even know their names. So actually, whatever you voted on, we didn't get anyway.
Yeah, 2 quick examples of why this is so bad, and the regulations come out. In the debates with Mitt Romney, President Obama pointed to the Cleveland Clinic as a place for great care and lower costs. The Cleveland Clinic announced this week they are laying off many employees. They're cutting $300 million of expenses because of the health care law.
I don't know if Toby Cosgrove, who was the CEO, whether he's backpedaling or not, but I talked to him a couple hours later, and he sort of thought that we were taking a little bit out of context what he meant. Now, I don't know if he's sort of backtracking or not. I mean, certainly that the health care bill is having an enormous impact on his medical, in his hospital and hospitals across the country. He was saying that, but he was, at least with me, he was trying to sort of backpedal a little bit. We talked on the phone.
And the other is the exchanges, which open on Tuesday, and even USA Today, which seems to like it, you know, said, hey, you know, expect trouble. The exchanges, if you join in California, which the president highlights as a place that's working, you remember that exchange? You can't go to the University of California hospitals.
But
you can't go to Cedars-Sinai Medical Center. You're excluded. In New Hampshire, over a third of the hospitals have been wiped out from the exchanges. People are not getting good insurance.
Here's what I don't get. I mean, the whole idea was that if everyone pools his money, everyone puts money in the pot, that was we're going to spread the risk and lower the cost. The next thing I know, I turn around, everybody's getting exemptions. Big business getting exemption, unions getting exemption, Capitol Hill gets an exemption, or a waiver. Everyone's getting these exemptions. I mean, who's left to pay? I mean, if people are getting special deals, we're right back to the special interest where special people get special deals.
Which is why I support David Vitter's legislation, but even the unions have now come out against the health care law. Young people are finding that even with subsidies from the government, they're going to be paying a lot more than they should be paying for their insurance. There's an incredible sticker shock coming. One
quick question. You see that Senator Cruz did read a short story to his 2 young children because he wasn't home to put them in bed, and actually there's a picture that was tweeted. I don't know if we have that picture, tweet of the 2 little girls as they were watching him on TV getting the bedtime story. So at least one sort of sweet little thing happened tonight in this. Anyway.
Heidi's there to put him to bed.
Indeed. Senator, thank you, sir.
Thank you.